we'll start a little early. Sarah put together this review quiz, and correct me if I'm wrong, but they can scan or they just go to. So join my quiz. Look, I'm a boomer, all right? So I'm learning all these cool things. So joinmyquiz.com, and then they just type in that code. Well, let me get out of the way for the people watching, or that's going to be watching later. Um, and then that'll take them to the quiz. So Sarah, why don't you explain to them kind of how the quiz works, and that kind of stuff while I lock up and padlock the door and get started.
Kind of a prep for the test. You won't have all the time in the world to take it, of course, because we still have stuff to do in class, but like within a minute question, kind of like how you would on this. That's what I was thinking. Um, and it's gonna be like motion and stuff, so make sure you take your time.
Is this, and you might have said it, I apologize, chasing butterflies. This is just highlighting the lower extremity.
This is lower body today.
Which, correct, and that's what we talked about, John, kind of go back over kind of what we let off with motion, so.
And if y'all like it, then I can open it throughout the weekend, for y'all to use this as a study tool.
And then what we'll do is after they finish the test, then we'll go over it.
Yeah.
Sounds good.
And I'll also get feedback on like the ones that,
Does
if anybody misses anything, look up, we got it.
Does it give them real-time feedback or like after the test is up? Gotcha.
It tells you what to right or wrong. So kind of like a test. So it gives you that like anxiety that you need to do good.
Can they start when they're ready or it all starts at the same time? Gotcha. Is anybody not in yet? We're good?
Okay, we're gonna start.
Let's do it. So exciting. Do you have that number for this? We didn't show it that well, just in case.
So you must have this, all the other tab I have like the feedback.
Gotcha. Here, and you put in that. So try to figure out.
After this,
Yeah,
I don't, because it's like a live.
gotcha. But like you can retake it.
Oh, yeah, totally. Yes, I just have to end it for that. more minutes? Just 13
Does-
questions, so 13 minutes?
Is it pre-timed or do you decide?
No, I didn't.
Okay.
So I'm going.
Is there, just out of curiosity, because again, we want to make sure we get the full effects. Does anybody need more than a couple minutes of time or is everybody done? I guess that's a really unfair question. Does anybody need more time? Okay. I'll turn it over to you.
Okay, so we're just gonna go through these one by one.
What I'll do is since this screen is bad, I'll move the camera to view the computer over to view the side screen. See if we can get it.
Is that good enough? Okay, y'all just took it, so y'all know.
Let me ask you this. Can we pull it up on here? Can we try that?
Sure.
See, my picture on the device we just took it.
Okay, let's do this.
That's a good point, because if people are watching, but I do want to have a reference, so, just in case someone's like watching class, they're just like, maybe forgot the camera. So that's a really great point. So you guys will just make sure we're on the same question. If you pull it up on your device, but we'll also try to pull it up on the screen, just to kind of have a reference for the video that I'm going to be posting on my YouTube channel, which is incredible because it has 200 followers. I think that's good. I think I might get like a check for a penny or something. And that doesn't count my family. They follow me just to be nice. Yeah. That's my boy with his 200 followers. Oh, it's oh, sorry. What I'll do is I'll just to give some real time, I'll put the camera on you. And so well, no pressure. I might get a couple more followers. You could have your family. You could have your family follow. But so just if you don't mind, is that all right? You talked in front of the camera of sorts. We'll Photoshop, like a pumpkin head or something. So just if you don't mind, just kind of repeat for those that are watching that, they'll go to this, they'll type in the quiz, and then as we go over it, they need to follow from their own device so that they know to.
Okay.
All right, Dr. Stan.
So I'm going to send the link into the group me, or we can email it, and you can go to join my quiz, and then it'll be a code or it's a QR code of sorts. I'm sweating. Okay. We're gonna go ahead and get started though. So I guess we'll be talking about it, and I can show the camera like while we're talking about it.
And as you go through it, great way to ask follow-up questions. Like, what would it be like this? About that.
Yeah, for sure. Okay, so let's start with this one. Okay. So what is the position of her hips and trunk? Okay, so y'all took it, so I'm just gonna leave that there. So it's like this. So how I would have taken this, I would have broken it down into hips first and then trunk, so people can just see it, right away. Some people can. So first of all, if this is anatomical, and then this is how my hips are, then my hips are not anatomical. So I want to go ahead, because in my opinion, the obvious motion here would get trunk. I would get trunk before I would get hips. But if this is what my hips look like in anatomical, then this would be flexed at the hips. Because of that flexion at the hips, I also have trunk extension. So the answer here was trunk extended, hips flexed. Okay. Next one, how many ways can the hips rotate? I put a little hint, think of all the possible movements within the planes. So we have 3 planes, right? But whenever it comes to the hips and the shoulders, because we got ball and socket joints, we also have horizontal ab and add, as well as internal external rotation, and then we have flexion, extension, and sagittal, and then normal ab and add and frontal. So all the possible movements is 8. It's kind of true.
What do we not have in the shoulder? This well.
Not shoulder shrugs.
Because this is gonna happen. It's gonna work. I'm gonna catch a fish.
Okay. The next one was, and this is kind of tricky, but it's this motion of the girl in the red shirt, Miriam, and I don't know. You can or I can. Y'all saw it.
Teaching how much. See, I don't see how it's external when you do this.
Gotcha. And not internal?
Right.
Is that what you said?
Yeah.
And not internal. Interesting. Okay. At the right or the left? Can Okay, so we can all agree that the one that
You got,
has the well,
no, you got
I'm
it.
gonna get on the ground, sorry.
Well, good.
We can all agree that this leg, the one that my knee is flexed up with, that is either internal or external rotation. But y'all are saying this is more internal to y'all? Is that what you're saying? Or were you thinking that this hip had internal?
No, I guess I was looking at how the knee turns.
Oh.
The knee kind of, it's going internal with like reference to the body.
Okay, well, I guess that's a good point, but like this is whenever I would say references kind of get a little.
Well, what
screwed.
did the question say?
Well, but it's what motion occurred in the left hip, which is the first answer, and right hip, so the left hip is equal.
So that's very important to establish. If the question's asking about the hips, we don't, the knee possible rotation stuff is not that it didn't happen, but that's not for this question, right? We analyze things joint by joint. So if we're asking,
Yeah, that's what I'm saying. Like the landmark can get confusing whenever you get on the ground, or that's what I'm trying to say.
no, well, it wasn't about what you were trying to say. I just want to make sure we're establishing that we're not looking at knee possible rotation. That was all. Just want to make sure that we weren't analyzing knee rotation.
Okay,
You got it? Or you want to explain it?
I'm gonna try.
Go ahead.
And then you
got
do it
this.
if I don't do it good
You
enough,
got
and y'all let me know if I don't
You
do
got
it good enough. So if we started here and then we had this type of motion, can we all agree, can we see that this hip has abduction? Kind of that.
Go ahead. No. I'm using Ken as
Okay.
a reference here.
Yeah, of course. Okay, so if I was taking this test, I'd see this first. This is abduction, yes. This one, I could go ahead and tell that this is gonna be internal, external, because I'm pivoting with that ball, right? Like that. So whenever I see external, internal, I like to think of all the possible ways that looks like to me. So external here would be like if I was to sit crisscross applesauce, and I know that is external rotation. So if I was like this, then I can kind of fall back into this, and it's the same movement. Does that make sense, or does that
That's a
confusing?
really reference.
So this is the one where I was hoping somebody would get on the ground and do it and try to think of what this feels like.
Okay.
Because external, internal get confusing.
Let me step in. I love that reference, by the way, the sit back. So let's do, it looks like it's moving and it is. And just remember that the hip is kind of an illusion, right? Where the foot and leg come in, but it's actually because the hip is spinning out. The foot and leg go out, but it's because the hip is spinning in. Does everybody remember that kind of illusion? Sorry. When you cross your leg, so this is important because we're doubling the illusion here. When you do this is external hip rotation. Make sense? So if we don't have that, I could see where, because it's a double illusion here. It looks like it's moving and it is. This is external. This is internal. Notice when I have external rotation, when my knee is flexed and my hip is flexed, my lower leg is kind of inside, like my pubic symphysis is like, oh, hey, I see you. When I have internal rotation, it's like, where did you go? I see you. Where did you go? External, I see you. Internal, where did you go? So now let's go back to Sarah's example and say, does the pubis see the inside of the leg? Absolutely. This is her pelvis. She would have to internally rotate. Let's do this. Let's do this. Hold. Put your hand. Hold. Now take your foot off the ground and rotate to go back home.
Oh,
She'd have to internally rotate to line it back up. So she had to externally rotate
To go there.
when she left.
Or like, I would see this kind of like, if you know, again, like how they all look, if you could stand up and keep that leg as it is, it would kind of look like this, right? Now that's kind of hard to do, is to kind of keep it
Yep.
as it is as you stand, but
Your pelvis is never lost. So if you're here, okay, and my hip is in anatomical in terms of rotation, yes, it's flexed, but in terms of rotation, it's not externally or it's not internally. We're good so far? So watch. If I do this and I move everything, I don't recurve my trunk. If I move everything and I say, help me out, I'm old. And I say, hey, hip, how would I have to rotate to go back to where I started? Wouldn't I have to internally rotate to go back to where I started? So I had to externally rotate when I left. It's just I'm moving the socket about the ball. It's hard enough to see the ball about the socket with the illusion of internal and external. But when I move the socket about the ball, it's where am I at? Where did I go? How did I have to move to get there? I externally rotated that right hip. Here to there is external. And Sarah, I love your point. But you just have to angle to show them that you're crossing your leg. Internal, go back. External is where I went.
if you are willing and, you know, confident, would you try this real quick? Can we all kind of do a little laugh?
Sure, great.
So that maybe if this shows up on the test and gets out of the field, so we start everything facing forward, hands on hips. We're gonna pop up. Like you have a baby on that hip and you have to keep it up. That's how I kind of think about it. Whenever I'm done.
It's true.
Do y'all feel that? Do y'all feel one of the movements there?
Move, try, to me, it's best if you move your trunk and your eyes and then try to look and see your shin like in the middle.
Or can you see how the pubis is lined up? If you like a landmark,
If you,
that's a good landmark.
if you keep your shoulders level, that means your trunk is recurving. Let your trunk go along for the ride. And I think it's going to be easier for you to see, whoa, my pubis is looking at my shin now. It's looking at the inside. Does that make sense? It's easier to see to me if you move everything and say, oh, there you are. I had to do this in order to see you.
That's,
Is out of the because
The left hip is above, but the right hip has internal on it. In this case, it's. Because remember, I know this was several weeks ago. That's why I think this review is awesome. If you're here, if you're flexed, the transverse plane is owned by the long bone in terms of rotation. This is still as external as internal, as this was external and internal. External, internal, external, internal. So when Michael Jackson does, that's internal and external, right? Now my right hip is like, look, I'm related to the left hip, but we're two different people. Just because my left hip is flexed and internal and external is in this frontal plane doesn't mean my right hip, the same global plane is the same. So internal, external, ab and ad. They don't have to be the same thing. The sockets are doing similar things globally, but for one hip, it's internal and external because it's moving the socket of my left hip here is the exact thing as moving the ball here. It's the same motion. So yeah, what knee were you on?
My left.
Gotcha. Left hip, right hip, external. Because I'd have to internally rotate to line it back up. So I had to externally rotate when I left. Better? So again, it's one of the first illusions was, oh, foot comes in, must be internal. No, that's when my knee is extended. But when I flex my knee, when my foot comes in, it's external. Because my hip doesn't care what my foot is doing. My hip only cares about where it's spinning.
And if you feel that, you can tell how like leg extended feels the same whenever I bring my foot up. Like my hip has the same external rotation. It doesn't matter how I'm standing. Moving on. Let's do this one. Start to finish yoga positions, cat cow. so we asked about, motion pelvic girdle rotation because of what motion? And so answer choices, and I made this hard to prepare you for the test. Like, I know, like, you saw all these answer choices and you were like, oh, I know this could be hip or trunk. I know. So the first thing that I would notice is what motions are going on. I'm supposed to show y'all too. Doing that one. First thing that I would notice is what the trunk is doing. So my trunk starts out in a flexed position because it's kind of like that crunch kind of, or no, it starts in an extended position and then I'm going to a crunch position. So I know that I had trunk flexion. Okay. Hips, they started flex and they have a little bit of extension because they're leaving that very flex position.
Sarah, if you don't mind, use the reference less or more in the field in addition.
We are getting out of fetal. Finish. We started in closer into fetal, you're leaving.
For the hips.
For the hips, yes. So now if you can establish the motions, then you can think about the water bucket or the basketball, however you see pelvic girdle. We're starting very much like this, and then that water would have to go backwards as I have that trunk flexion.
You look like an Australian, you look like an Australian breakdance.
Okay, so I'm starting looking up, and then I end going forward. So because of this motion, the water's tipping out forwards. Thanks. And then I'm gonna go backwards with my pelvis. My pelvis is starting like this, and it's ending this way. I see the water. If you see the eyes on the basketball, that's gonna be 2219.
What was it?
2219. Nobody hack me, please. I would think of it like however you see it. Starting this way, the pelvis is going forward, and it has to rotate backwards. So that's that posterior movement.
There's still water pouring out when you end, but it's not pouring out as much. Right? It's literally almost like thumbing it upside down and then doing this. So even if you do the pour technique, it's pouring out less here, so it's going to be posterior. Right? If you do the spin technique like me, to me it's a little easier to see these because it literally is just seeing how the basketball will be spinning. Here to there, a back wall.
Or if you see it as the water, sorry, I'm not.
No, you good. Stand with the water. No problem.
Starting that one constant.
Absolutely.
And as I go backwards, I'm trying to kind of cut that out
Absolutely.
to go back to like an anatomical where it's not pouring out as much. Kind of like the into out fetal kind of thing. Not pouring as much as I go backwards into that movement.
Absolutely.
So if I was taking the test, I would break this down by what my hips are doing, what my trunk is doing, and then how the pelvic girdle is moving.
Here is her pelvis. If it was an anatomical. And then here is her pelvis. So like we go from like here. You see that? Like here to there. Posterior.
People that get, kind of tricked up with motion and stuff, I know it's kind of tedious, but I would write A, how you're starting, B, how you finished position-wise, the motion you had to get here, because this is a motion question. Okay, but it's
That's good.
position.
Sarah, that's a really good tip. And remember, you have scratch paper for that reason.
Right, not today, even, but test will. My bad, we probably should pass it up. Next, we're gonna do this motion. So she's laying on the ground. And just for our terminology here right now, her feet are starting, inwards, and then they're gonna be going outwards. Her feet are. Is that clear?
Absolutely.
Okay.
What a great question to really practice the take home of not using global references.
So here, again, like in your seats, this is the one I would have been doing, because if you didn't want to get up, you could do this sitting down. So we just established that this was bilateral external rotation at my hips. So then this would be bilateral internal. And you kind of feel this one, like this kind of hurts. It's like a stretch, like, that's what I want.
I don't even know if I can do this, Sarah, but I'm gonna try. So my right knee is flexed, my left knee is extended or in a top, okay? This is the same motion, and this is the same motion. Bilateral internal, bilateral external. Make sense?
Yeah.
I'd never done that before. I just had all the.
Very good. Also, like, let's say that she was prone, she flipped upside down. Her legs would still be starting. I think that therapists do this a lot. Like, this is a passive.
This is how I read books.
Okay, can I follow you?
Okay.
Okay, so they would start. Okay, they would start this way, and then they would pull out, and that's the internal. So do you see how that's the same movement, but now we're just switching positions? So then that would be, go ahead, go back in with your legs. External, bilateral external, just like whenever I was crisscross. So it's the same, depending if you're sitting on your good.
Okay, watch. I'm gonna freeze. I'm gonna try to freeze. Same position.
External. Internal. So you like look at the knees. Do I go? I don't, but if that's a landmark that you get comfortable with, I think that bilateral kind of.
You can use, let's not say knee. Your patella, I think, is a fair reference, because your patella is always gonna follow, unless you have a dislocated patella. Your patella will always kind of represent your femur, because it's kind of locked into place with your knee has been. So external, internal. But to say the whole knee, is that below, is that right? So, but if we say, hey, I'm gonna look at my patella, external,
Yeah, that's fine.
internal, good. And that's why we clarify, just to make sense, just to make sure, we don't want to assume.
Okay.
I like, and Sarah, and what I love about Sarah, she'll be honest, I like to plant the flag. That's how I like to do it. So like, here's my femur, flag plant. To me, this helps show the external spin. And, obviously don't stab yourself, but you can use like your thumb to help reference as well. It's just the patella is going to be right there. Is there a way to, not to call anybody out, is there a way to see of the questions we've went over, which one we've had the most misses on? How much that one before, just out of curiosity? Like half and half, or was it more makes than misses, or?
The internal one we just did? Two people got it right.
Okay.
So I would say about
all right.
20 people, so good. Two
Okay.
people got that off of.
Hey,
Internal, external is confusing.
What matters is next week.
Right.
What matters is next week.
And this is gonna be a good study for you.
Absolutely.
So next week, we have that same position. We have that same picture. Same trunk extension, hip flexion, and now I was asking about, can we see that somebody stands like this would be anterior, water, or basketball forward? I wrote those questions up just to make it.
And I like how you're mixing motion and position too. So remember on the first test, guys, position is just where you at relative to anatomy. Motion is where you go.
Position and motion don't really. Trunk is all. Not always.
Watch, Ken can't move his trunk. Anterior pelvic girdle rotation because of hip flexion, Ken's trunk stayed straight. If Ken could move his trunk and he wanted to stay like his shoulders upright, Ken would extend his trunk to help cancel out his body going forward. His trunk would extend back. So that's what Sarah was showing you here. The hip flexion can be canceled by the trunk extension because if I don't extend my trunk, I got no choice but to do this.
We got this one next. This is another illusion because you're kind of just out this position. Ooh, that's not very clear, so I'm gonna get that and show you all.
Ta-da! It looked like a gymnast, like ta-da.
Okay. Started here would be my starting position, just kind of like before, and now I'm moving this way. This is horizontally abducted. Got that? Oh, this one, 3 people said horizontally abducted. So I just want to make sure we all see it now, that we're moving about this way, and it's not internal external. Because this was that internal external, now I'm moving that.
And would the right hip be just out?
Good. So
Is it a position or a motion question?
this is a position
A
question.
position question. So if that, seeing what we saw in there, remember on the test, there's got to be some obvious stuff. Most likely, it would probably be abducted. But if it's not enough to definitively like, right, if it's kind of like, we're not gonna ask the question.
But you can definitely say,
You kind of internal externalization, but it's not internal.
The internal and external would be honestly easier to see, right? Because as long as using that patella, so the internal and external, you'd have to have transverse pelvic girdle rotation of some type, right? So the only one that I think would really kind of be more obvious is that my pelvis is tilted laterally. So if it's right laterally tilted, my right hip has to be abducted. But I do not have to, to me, it's easier to see the rotation because I have to do this kind of stuff.
that's something that you're doing right there when you do it that way,
Mhm.
correct?
Yeah, this would be internal and this would be external. So the internal and external to me would be easier to identify. The lateral would be the one that's kind of make sure that it's super obvious.
Any questions on that one?
I'm gonna have to ice down after this. Is this what they call Pilates?
The next picture was the soccer player. Sorry, it's so blurry. This one is hard. So this one, it's not a trick. I didn't put flex. And if you said the knee was flexed, you're not wrong, but the knee can do something when it's flexed. So there's something more obvious happening than just flexion here. We can see that with the location. If you like a landmark at the knee, right, Dr. Campbell?
Yeah, absolutely.
So this is that cutting and planting that people do when they need to change position quickly.
Here's one way to look at it. The foot, the patella is facing here. Sure. The foot is more kind of coming out here, and the patella is looking there. So that difference, if they were lined up, the knee wouldn't be rotated. The fact that the foot is more like here and the patella is more like there, that's the example we gave in class about the cut and plant, where the knee is going to have some rotation when your knee is flexed, or you rip your knee out every time you try to flex and twist.
Right. So because this was a position, this was externally rotated, but knowing that, if you saw this picture and now it says, what motion would he have to get back home? Would that be internal, right?
Since he's planted, I don't know if this will help everybody else, because I didn't even have to get him to do this because I did this, so I understand exactly what it was, because I could feel it just sitting here.
Strong.
So with the foot, the planted foot it's like this. So once it's planted up on your body weight, your hip has to be. So when you go back to anatomical, it has to go in, if that makes sense.
Are we ever,
Then
are
I
you
just-
having? You're
It's
gonna,
not-
exactly. So, but we're gonna make it a hip conversation, right? Okay, so let's talk about the hip. You said what the.
So, well, maybe not this position, but you would get up and show us what you're talking about, so, cause he's kind of
I
different.
mean, it's not a hip conversation. It wasn't a hip conversation, question, but like, let's say this is my feet and they're anatomical. So his plant foot is like this. So you have to have, cause you, like, even if you do it with your hands, you can feel the rotation in your.
But the issue though is that, you see how you felt the rotation in your shoulder? Like when you do this, you felt that motion in your shoulder. The fact that his knee is flexed, that's why we do it, is because my hip doesn't have to rotate now.
Doesn't have to.
It doesn't have to. I could be in a cast and still have knee rotation.
Yeah.
And that's why we do it. It's so, because if the hip, remember hip rotation, when my hip is flexed like this, if my hip rotated when my knee is flexed, I would literally rip my knee out of socket.
That was the next thing. I was like, one has to, I think, because if we did.
Exactly. And that's why we do it, is when our knee is flexed, we need to be able to do this and not.
That's how, too, because like the foot's moving,
Uh-huh.
the shoulder, the hip has to move too, because I can feel the hip. That means the knee has to move because.
Yes.
Because the
Yes.
hip is moving, because
Well,
anything would be like.
But just remember, I can move my knee and not have to move my hip. That's the key.
Yeah.
Can the hip move? Sure. But again, I can have my hip in a cast and still have knee internal and external rotation.
And that knee external rotation wouldn't be obvious, like Dr. Campbell said, like it would be, if it's lined up, like the
Patella's a great line.
It's probably not internal external, but if it's that obvious.
Yeah.
Inwards, you said I could do this very
Yeah.
lot, right? That would be.
Our two local landmarks, knee, the patella, and the foot. If the foot is lateral to the patella, I have to be externally rotated. And if the foot is medial to the patella, I have to be internally rotated.
Okay, so now we went back into this one's cow, it could be cat. Anybody know? It's one of the cat and cows.
That's a cat.
Okay, this is kitty. Okay, that's from cat. We got a knee and an ankle question here. A lot of people got this right. Dr. Nebraska back off, just throws me somewhere else. So the knees are flexed and the ankles look like this if I was to be standing straight. They look like this if I was to be doing this straight on. It's plantar flexion, so they're plantar flexed. And a lot of people got that one. Okay. This was a picture from the unit. And it says, what movement will bring him back to anatomical? So he has his hand straight to show you that one's still an anatomical. So we're not talking about that hip, we're talking about this one.
In other words, one hip is already home.
Right, we don't have to worry about that one. Anatomical. So we're talking about this one. If you could see that this was abducted, then you know that adduction would bring you home.
You good?
That was that. Now I'm gonna a little bit quicker because we got a minute, so sorry. Okay, next one. What motion at the left hip is observed? Starts this way, ends this way. Just horizontal ab. Started horizontal ab, AB, and then we're bringing it back home. That's an ad, horizontal adduction.
Just remember, it's the same thing as ab and ad, but your clock is now lying here. So away from 6 towards 6.
Not here.
And the pelvis is transverse here.
This one, now that we've gone over external, internal, do y'all see how there's one happening at one hip and not, and the other's happening differently? Like they're not the same movement, I'd say. one hip is having external rotation, the other hip is having internal rotation. Really like this one because you can see how they're,
So if you were answering in a position, where are you at? Which hip is internally rotated, the right or the left? Remember, her perspective, her right or her left? And which one is externally rotated? Good. And remember, if Sarah's asking you about rotation, it doesn't matter. Well, one's flexed, one's up. We're just asking you how is it spun. Okay? Yeah, let me see.
so what's your rotation? Right. This was a subtalar question. So we're going down or right, so we're kind of like lunging. And because of that pretty obvious lunge, we're having subtalar movement. One angle is going inward, inversion. I know that's not the correct word, but that's how I see it. Inward, and the other one is pressing outward. So that's eversion. You see that? I know it's been a minute, so I'll have subtalar in your shoulders.
I think some of them are like as many as you can.
That's it. You don't have to do.
Let's practice. I think, practice pelvic girdle stuff because of hip motion. Use your local landmarks. Remember, I'm not saying don't use landmarks, just don't use your room's landmarks. Use the landmarks within your body that work. And practice, practice, and practice. Friday, we'll have an upper extremity review. Monday will be an overall review. Hopefully, fine tune anything. I think this is why it's important. Last bit of advice, why it's important to practice now, because if you come Monday and there's just too many things to try to, Monday should just be the fine tuning kind of questions. Cool. Thanks, Sarah.
Good enough.
Tips Unlimited.